Everyone, and welcome to our workshop today on old data, new tricks, new data, new tricks. My name is Abeer, and I'm the project manager for the Pathways to Equitable Cities program. We're a global partnership with research institutions based in Canada, the United Kingdom, Ghana, Bangladesh, and China. Our goal is to improve population health, enhance health equity, and ensure environmental sustainability in cities. We work on generating empirical evidence bases using methodological advancements to document health and environmental inequalities in major cities. As we'll see over the coming days of this conference, cities across the world have significant variation in health across their population, particularly between low and high socioeconomic groups who have unequal opportunities for good health. To address the challenges of urbanization and create accountability for equitable urban development, we are required to identify and support deprived groups. To do this, we need current, comprehensive, and detailed data and methods. For example, traditional administrative data, like censuses, having comprehensive population coverage don't always include relevant social outcomes as a measurement. And we therefore, in our group, explore unconventional data sources such as imagery or web collection to supplement our understanding of the city. Our research is data-driven, based on different cities and populations, and uses context-specific methods, both old and new, to fill gaps in knowledge in order to develop and evaluate policies centered around health equity. Today, we've organized the session into 3 themes of environmental health. The speakers today will demonstrate how we use these emerging and classical data sources and methodological approaches to capture information to have a holistic image of the urban environment to identify opportunities for growth. If you'd like to get in contact with us or tweet at us during the conference and during our session, please do at Pathways to Equity or use our hashtag PathwaysICUH. So just so you know, before I introduce the first theme, we're going to have sort of 6 presentations in total. And after each theme, we'll have time for a few questions. And we'd like to save our larger discussion for the end of the presentation once you've heard from everyone. Our first theme aims to identify as a spatial representation of those burdened by economic and health challenges. The first presentation will detail how this was accomplished using traditional data surveys, and then we will explore work done using images to map the urban environment. So I'll bring on stage Honor and Alicia.
Great. Good morning, everyone. So we're starting with work we've done to characterize some of the multiple dimensions of inequalities in the city of Accra. So a short 2-kilometer walk in Accra will take you from the historically impoverished neighborhood of Nima to the wealthier ex-colonial neighborhood of the cantonments. And looking at these pictures, we might have many assumptions about the living standards of these 2 places. But even if they may rank similarly or different, 2 places that do rank similarly in economic terms might experience very different challenges. And when we think about and measure poverty, we often place emphasis on monetary measures, but urban poverty is not just a function of household wealth. And while an important indicator, monetary measures do not capture the full extent of deprivation and can mask varied lived experiences. So, characterizing multiple dimensions of poverty and inequality at high spatial resolution allows us to identify the most pressing challenges and who for and where they are most acute. So censuses and surveys can provide a lot of insight if interrogated the right way using innovative tools. And in this work, we employ a variety of indirect estimation approaches that combine these more traditional data sources to comprehensively map indicators of poverty and inequality at fine spatial scales, so scales that are particularly relevant for cities. And we look at monetary socioeconomic indicators as well as water access and child mortality in the Greater Accra metropolitan area. And this is the largest metro area in Ghana, containing the capital. And Ghana is in turn a rapidly urbanizing country in West Africa. So given the fairly routine nature of surveys we use, these include the Ghana Living Standards Survey and the Demographic Health Surveys, and the routine nature of censuses, these tools can be widely applied to understand urban life and the challenges faced by city residents across other lower middle income settings. So the methods we use really combine different data sources to leverage the strengths of each of them while simultaneously overcoming their shortfalls. So we partnered with the Ghana Statistical Service to get access to the full microdata of the 2010 census that included data of over 3 million residents in Accra. And for each of the indicators we're about to show, by applying novel tools, we get the full population coverage and detailed geographic information of the census, combined with the direct measurements of outcomes of interest in the surveys. So through this, we get closer to capturing the lived experience of poverty in an absolute sense, but also relative to the surrounding people and places.
So a classic way of understanding well-being is through socioeconomic status. In Ghana, income is not available in the census, and socioeconomic information is only available at larger geographies in the Living Standards Survey. So we employ a small area estimation technique to work around these limitations and borrow strength from both data sets. The only requirements is that these data sets have comparable populations and variables. With access to 100% sample, we were able to take advantage of the detail and obtain really robust estimates, particularly for small areas. The basic procedure is estimate the log of equivalized household consumption or any income data you may have using a linear mixed model with the survey data. And then we take the parameter estimates and apply them to census data, predicting consumption for every census household. And then from here, we developed poverty and inequality estimates for small geographies from these household estimates. The GIF shows where individuals of different consumption levels live in Accra, from poor to affluent. The poor are typically more concentrated in peri-urban Accra with concentrations in the central city, whereas the wealthy are typically live closer to the urban cores of Accra and Tema. The purple map looks at inequality within neighborhoods. Accra's high population means there's a wide variety of consumption habits in small areas. So we can use this map to look at where inequality is the greatest. The deeper purple shows more unequal neighborhoods, and these areas are typically in areas of new development, such as near the airport and the recent mall developments in Accra. Oh. All right. So we can map poverty and inequality for any reference geography, providing easy to understand and locally meaningful information for small areas. We use these maps to draw our attention to particular areas of concern within the central district of Accra. The left map isolates the poorest 20%, showing where they're most concentrated. High concentrations in along the coast, along the Oda River, and near the university. But we can also take the entire distribution into account by examining segregation, for example. The map on the right shows where the extremes of the distribution are concentrated. Orange areas are places with more poverty, which reflects what's on the left map, but it also includes places that with more concentrated affluence. And it really gets at that point we made earlier that there are areas within very short distance of each other that have very different economic outcomes. And then even so, we can see from the map, there's a lot of mixing of different income levels within Accra. So consumption levels cannot fully show whether certain standards of living are actually being met. So we need to consider non-monetary indicators of well-being, such as child mortality and water consumption, to really interrogate levels of deprivation.
So we estimated child mortality at the neighborhood level in Accra. These are clusters of enumeration areas that Alicia will show. And we used data from over 700,000 women from the census, where they asked people how many children have they had and how many children are surviving. And these are commonly known as summary birth history data. For each neighborhood, we converted these summarized counts into child mortality rates using demographic methods. And these methods, in short, are very similar to the regression procedure that Alicia just described for the socioeconomic estimates, but instead use the more complete birth history data available in the DHS. And then we applied a Bayesian spatial temporal model to estimate rates for 2010. So overall, we estimated that child mortality varied about fourfold across all of the various neighborhoods of the Greater Accra area. On average, rates were slightly higher in the central areas and the industrial districts to the east. And these tend to be more densely populated. Rates were tended to be lower in the peri-urban areas, as you can see in the kind of purple gray shade. We also found considerable variation among the city's various low-income and slum neighborhoods. And those are some of the neighborhoods labeled in the Accra metropolitan central area. So Momobi performed the worst of all neighborhoods across the city, whereas others such as Jamestown and Ushertown performed markedly better. And this is work on drinking water that was led by our colleague Jacob Tetteh, who unfortunately was unable to get a visa to be able to make it here today. But these two maps show different aspects of water access inequalities. On the left, we have an indication of the diversity of water source types available within Accra. And on the right, we have the dominant water source. So in central Accra, it tended to be dominated by piped and vended sources, whereas the western part of the city and the Gar districts showed a very mixed water landscape, including vended sources, piped sources, and unimproved sources. And those red highlighted EAs, these were all characterized by having just a single water source type for all residents. So piped water was often dominated areas of low diversity, which may signal that piped water is more reliable in these areas. And they might have well-developed water provision infrastructure and fewer interruptions to the service. Generally, sachet water dominated the areas of high diversity, which may place a heavy burden on households because it signals that not only the low quality of water service infrastructure, but also the reliance on marked up vendor water from private sellers.
So we're also interested in how water accessibility is clustered with socioeconomic status. The cluster map shows where affluence and poverty are associated with high or low levels of water diversity. However, to determine whether an area experiences water deprivation, we also need to consider the types of sources in particularly stable or unstable landscapes. So we can look at all these maps together to look at how the clusters align with the dominant source types to determine water accessibility in the areas that are most in need. So the dark blue clusters show poor areas with few water source types. In some cases, this can point to good provisioning landscapes. In Tema, for example, these clusters largely reliant on piped infrastructure for their water. But in other cases, low diversity and poverty can be a red flag. In the peri-urban Ga South, where that one of the furthest left black arrow is, this points to low income areas with limited options that rely on the unimproved water sources from unprotected rivers and streams. Okay, so taken all together, these data are greater than the sum of their parts. Combining data sets to take advantage of their unique properties while avoiding their limitations allows us to map data at a fine scale. This poverty mapping exercises are critical for decision-making, monitoring and evaluation, and communication. They help policymakers identify areas of interest, but also provide a level of transparency on where resources may be directed, and present a baseline for future research. And moreover, they provide visual representations that are really familiar and easy to understand because most people know how to read maps and most people know what their local neighborhoods look like. So it helps you site yourself within the city as a whole. These individual metrics can identify where the challenges are most acute, but we can use them in combination to triangulate these areas that are most deprived along multiple dimensions. So for instance, the maroon circles on the left part of the map highlight a peri-urban area that experiences multiple deprivations. While the surrounding area is also poor, this area faces much greater child mortality and lower water quality. But other times, an area will not be deprived along every dimension. The blue circles show an urban area of Tama West where there is high poverty and high child mortality, but they have improved access to water, indicating that they're deprived in two particular dimensions, but not everything. But ultimately, places experience poverty differently and face different challenges to improve well-being. So mapping can be a powerful tool to understand the full extent of deprivation in these places and identify the areas of most concern in particular neighborhoods. All right.
Hola, buenos dias. My name is Emily, and today I'm going to be presenting on the use of images to measure socioeconomic variables in the city. And we have some colleagues who are also leading this work who weren't able to join us, so I'll just be presenting on their behalf. Okay. Images capture unique snapshots of complex urban processes, which can occur across relatively large or relatively small spatial and temporal frequencies. Changes in socio-demographic populations, driven by economic activity, housing prices, accessibility, and so forth, may be captured by images, as demonstrated on this slide. This line of work seeks to interrogate how can we use images to measure indicators of socioeconomic status. So we broadly approach this work from three separate dimensions after our initial proof of concept study. We then ask, what if we don't have any data for a city? Can we harness information from one city and apply it to a new context? After that, we ask if we can actually impute data within the same city from missing neighborhoods. And finally, what if we don't have any data for an outcome? Can we actually go ahead and create our own data set? So in our initial proof of concept study, our question was whether we can use street view images and machine learning to measure indicators of inequality in London. So as an initial step, we first had to download images, and for each of these 3 points illustrated, we downloaded 4 angles of rotation and merged them to outcomes. So outcomes are coming from both the census, surveys, indices of multiple deprivation. Afterwards, we trained a deep model then to predict the deciles for each of those outcomes at LSOA level, which in London, I think, James, you might correct me, is about 1,250 homes. He's telling me no, but it's, yeah, 1,500 people, thank you. And finally, then, with the holdout test set, we can predict the outcomes of interest. So on the left-hand side, you can see the observed ground truth for income in London. In the middle, you see how our model predicted on the held out test set. And on the right, you see the scatter plot of predicted versus observed. And in a perfect model, we would see just the diagonal being represented. And you can see that for predicting income, our model actually does quite well. So we have an error of close to 1. So generally, the model's predicting the correct decile plus or minus 1. So extending that, we then said, okay, well, can we use information from different cities to predict another? And in this example, London, with the sort of underlying assumption being that we can harness data from harness information from low context environments, and then use that in harness data from cities to be used in a city that might have not a lot of data. So in London, for example, income estimates are not reported in the census, similar to Ghana, and the income estimates that we did use were coming from a 2017 survey. So we could then say, well, can we get a more timely and up-to-date estimate of income using more recent images? And you can see for the cities that we did train on, so if you can see, we've basically got cities from Canada, US, and Australia and New Zealand. And generally, the models actually are not that good at predicting in London. So none of them are competitive with London, and some of the worst ones are coming from Toronto and New York and Vancouver. And when you look at how these models are predicting spatially, the bottom three maps, generally they're predicting that the poorest deciles are in the center, and then around Greater London is where the wealthy neighborhoods are distributed, which is not reflective of the ground truth in London. So looking at across all cities, and on the left-hand side, we've got the errors for predicting the poorest. On the right-hand side, we've got the errors for predicting the wealthiest. We generally see that wealthier neighborhoods in cities look more similar, and this is characterized by a lot of blue on the right-hand side, whilst poorer neighborhoods actually seem to have distinct visual features which are more difficult to generalize. In addition, cities that are coming from the same country, so cities in Canada or US, tend to also have lower errors. And to understand this, city differences are driven by complex dynamics, and which might include geographical or historical factors, as well as local policies. And if we look at the distribution of, let's say, London's poor, we see that it's both distributed in the center and also around Greater London. Whereas for a city like Toronto, we actually see the urban poor is mostly distributed in the center. So for these two city centers, we have very different income distributions, but we expect the visual environment to be quite similar. So high density, lower proportion of urban green. And this is just one reason why transferability across given contexts is limited. In the next study, we then said, okay, well, for a city, can we impute missing SES data? So for Beijing, similarly, there is no income estimates and from the census. And we do actually have some socioeconomic status survey estimates, but it's missing, right? So in the left plot, you can see the gray areas actually do have data and the white areas do not. So similar approach now, but we can harness information from the same city, which because now the source data and the test data are close in distribution, we expect them to be able to predict better than our across city transferability. So similar process, we merged them to the areas, we predicted on various different outcomes. And in this situation, in this analysis, we used not only Street View, but we also included satellites. And you can see here in the plot in the middle, we've actually mapped, this is just for income, we've mapped income across the entire extent of Beijing. And we also observed that including both of these data sources provides lower errors than either one of those alone. And so finally, the question was, if we don't have any outcome labels, can we go ahead and create our own data set? And to approach this, we use perceptions. So users are asked to rate between two images, which street do you think is more wealthy? And asked to say the left or the right, or none. And the idea behind perceptions is that it harnesses our individually held image of the city to create a global consensus model with which we can say, okay, this area is, in this example, more or less wealthy. So after initially doing the crowdsourcing and collecting lots of these ratings, we can then rank them, where we use Microsoft TrueScale algorithm to rank all of the images and give them each a score. So on the left-hand side, you can see a subset of those images that are coming from the less wealthy distribution. And on the right-hand side, you can see a subset of the images coming from the more wealthy distribution. And after which, again, we build the deep learning model to say, okay, can you now predict those that are more or less wealthy? And finally, we can use that to map in London. And one of the additional benefits we can get from this is that we can disaggregate. So I mentioned the LSOA was 1,500 people. Because we have image-based outcome labels, we can disaggregate to output area level, which is about 125 households. Yes, 125 households. And you can see immediately that the map on the right, which is the perceptions-based map, is much better than the across city transferability maps at predicting. So to conclude, and I think this is something that we've all learned over the past couple of decades, machine learning and data is never the panacea that we would like it to be. And so we have to keep various things in mind, but we have been able to show that images provide a meaningful way of tracking spatial and temporal changes, bearing in mind that the ground truth information can be at different spatial scales. And also image data availability, what I've spoken about so far has been a lot in the global north, and the data provider that we have doesn't necessarily cover other areas as frequently. And in addition, I didn't go into explainability or interpretability, which is a really important part of this work to make sure that none of the predictions are coming from spurious correlations that are not actually associated with what we believe to be the underlying factors. And then finally, there's a promising avenue to where we have human in the loop for image surveys, and it provides a novel lens for subjective experience and ultimately how people actually engage with their neighborhood. So thank you so much for listening. And we also have data available and code available if you would like to look further into any of this work.
Wonderful. So we could take about 2 questions if anyone has any for the presenters that we just had. Sorry, they're going to bring a mic to you.
Okay. Well, thank you. That was really, both presentations were very, very interesting and thought-provoking. One of the last points was about the importance of the ground truth data set. And my question was, for the first presentation, is there a ground truth measure of multidimensional poverty in your analysis? And what was it? Was it the Living Standards Survey data, or how are you sort of organizing these multiple data sets? Is there one that you're using as sort of the ground truth for comparisons?
Oh, great. The standard surveys, the direct estimates. So we had a slide that points out the areas where they've actually gone and grabbed the indicators that we are predicting. Again, much coarser level, much lower sampling than the census, but the statistical service has done a lot of great work and helping us linking these 2 data sets together. But we typically just use these direct estimates to as the ground truth, and then ran a series of models. Like we said we ran one model. No, it was more like it was hundreds of like trying different specifications to see, okay, can we actually capture what's on the ground truth? How accurate are predictions? And actually was a very long process of iteration and developing different specifications for our models. But we typically use those surveys as our standard.
If there are any other questions, if not, we'll move on to our next theme. Cool. Awesome. Thank you both, or thanks, 3 of you. Right. So our second theme today is sensing the city. So as measuring physical, natural, and social environments is vital for developing an evidence base for policies, our second theme focuses on sensing the city. Our researchers will be speaking of the use of environmental measurement campaigns to illuminate the inequities and dynamics of environmental quality in resource-limited cities. So first is Sierra.
Hi, everyone. My name is Sierra, and I'm going to be presenting on behalf of myself and colleagues on the why and how of sensor network operation for mapping air and noise pollution. So first, just starting off with a bit of background on sensors and sensor networks. When we talk about sensors in the context of air noise pollution, we're really just talking about instruments which measure things, typically levels of pollution, but can also be other characteristics of pollution. And they can do this in various ways, either directly actually collecting samples of pollution in the instruments, or optically or electrochemically. And as I've illustrated with just a few examples of some monitors or sensors we've worked with in the past, they can come in all different shapes and sizes, have various capabilities, levels of precision, accuracy, but also price ranges. So then expanding out now to sensor networks, this is essentially just a collection of sensors working together in some coordinated fashion over space and time. And sensor networks are used all around the world to provide very useful information on the levels of pollution, but also inequalities between different places. And depending on the setup of the network, they can also tell us about sources of pollution and its composition. And data from sensor networks have also been very useful in being able to build and or validate predictive models of pollution. And these can give us what I would call a continuous surface of pollution over an entire area. So instead of having one value linked to one location where the sensor is, we can have values at all locations filling in gaps over space. As well, sensors or monitoring networks have been and still currently are very instrumental in being used to assess the compliance in terms of the levels of pollution and ultimately enforcement of environmental regulations and laws. So now when setting up a new sensor network location in a new place, there's various different design considerations that need to be taken into account. The most obvious one is, what type of pollution are you trying to measure and how do you expect it to vary over space and time? That will tell you about, the number of instruments you need and how long you're going to put them out in place for. But also very importantly is to take into account where you're actually working in the local context. Because there's going to be various things related to that which will influence your design, such as, the social acceptability of what you're doing or where you're placing monitors, local resources, infrastructure support, even time constraints, like is there any seasonal constraints in terms of when you can monitor and when you can't? So essentially there's no one size fits all approach for doing this. It'll really depend on where you're working and what you're trying to achieve. So the sensor network that I'll be introducing today, we implemented in the Greater Accra metropolitan area. As was mentioned before, it's the capital and largest city in Ghana. And as you can hopefully see from that inset map on the slide, which is an aerial view of just one neighborhood of the city that I picked out, there's quite a diversity even across this small area in terms of like the land use, the landscape, as well as the built environment there. Like for example, you can see a large green space up to the top left. It's cut off underneath by a major highway with very busy traffic flows. And there's also an international airport wedged in between very dense residential areas. And I mention these things because these, in addition to other local sources, other regional sources, all come together to influence the emission of pollution, its propagation, as well as attenuation, even across small areas, influencing people's exposure to it. So we took this diversity and complexity of built environments as well as source distributions in Accra into account when designing our sensor network. And just to keep this brief, what we did was we coupled week-long monitoring at 136 locations across the city with year-long monitoring at 10 locations. And collectively, these locations covered a wide diversity of different neighborhoods in the city, all with different source profiles. And what we were interested in measuring was PM 2.5 air pollution, so fine particulate matter, nitrogen dioxide air pollution, noise levels, as well as the total sound environment. So it's like, the bad sounds, but also potentially the good sounds, like nature sounds, weather conditions, as well as street view imagery, which you'll hear more about in the next presentation. And as I mentioned already, there's no one-size-fits-all approach to setting up a sensor network, and we really had to think about the local context in which we were working, and that influenced our design. So we did this in many different ways, but just a couple of examples are that we couldn't rely on plugging our equipment into the electrical grid, so we had to have equipment which could last with 7-day battery power. We also had to think about the climatic elements, so like sometimes Accra has, these massive rainstorms, but also these seasonal dust storms. So we needed equipment which was quite rugged, could withstand those elements. And we also had to custom design an equipment enclosure, which you can see in the images on the slide, both to protect the equipment from the weather, but also we had to design it so that it could be set up sort of in, as I would say, many different types of mounting infrastructure, whether it was the pole or side of a tree or someone's house. We had to really just make use with whatever we had. So we had to adapt our network in all these different ways. And now with this slide, I'm just giving a bit of a flavor of the scale of the data that we were able to collect at each location over the span of, this is just an example for 1 week. So at one site for a 1 week period of monitoring, we could collect over 10,000 minutes of real-time air and noise pollution measurements, over 10,000 seconds of audio, meteorological measurements, and 2,000 to 4,000 images. So it's quite a lot of data. And I'm also showing this graphically as well, just to give more of a visual of what we were able to collect. So the time series plot on the slide is showing a week long of data of both noise levels, but also ambient PM2.5 air pollution levels at a major highway site location. You can see that the levels are generally quite elevated, but there's also these very clear diurnal patterns as well, which we can relate back to the imagery that we collected at that site to see how time activity patterns change throughout the day and over different days, as well as the presence or absence of different potential sources. And as I mentioned at the beginning, data from sensor networks can be very useful in building or validating predictive models of pollution. We did this within our project with statistical land use regression models. And I'm just showing a couple of examples of the outputs of those models on the slide. The top two maps are showing the seasonal average nitrogen dioxide concentrations in both the Harmattan and the non-Harmattan season. The Harmattan season is a period when dust storms from the Sahara Desert basically make their way over to Accra, influencing the air quality, making it worse. And in this case, the red color indicates higher nitrogen dioxide concentrations, mostly concentrated in the central urban core district, as well as along the major road networks. And then the bottom two maps are showing the annual average noise levels, both in the day and the nighttime. So just to finish off with some reflections, sensor networks are very powerful tools for many different things. They can tell us about the levels of pollution, inequalities between different places in pollution levels and exposures. We can glean insights into the sources of pollution as well as the composition of pollution, and they can help us build predictive models as well. Though, as I've reiterated throughout this presentation, there is no one-size-fits-all approach to implementing these networks in new locations, and considering the local context in which you're working and its potential constraints, but also opportunities is really important when designing this type of thing. Sensor networks can also be designed such that they measure multiple features of the environment concurrently, so you can get more of a holistic picture of environmental quality and co-exposures. And you can link the data to additional data sets as well, such as administrative data, to look at socioeconomic inequalities of exposure, for example. And very importantly, and this is something that we are currently working on right now, they can feed into health-based analyses, such as local epidemiological studies or health impact assessments, to be able to translate what those exposures mean really in terms of local health burdens. So that's all for me, and I will pass it on to my colleagues.
Okay. So in the previous talk, we heard from Sierra how sensor networks and measurement campaigns can give us an indication of the extent of environmental exposures in cities that affect people across both space and time. And in this talk, we'll be talking about using images to do the same, while also shedding light on the sources behind these environmental exposures and other drivers of environmental change in cities that affect health and well-being. The intuition behind this field of research is fairly simple. It's predicated on the idea that lots of important features of environmental health are visual in nature. So as mentioned in the previous talk, from aerial imagery, such as those captured by satellites, differences in vegetation, infrastructure, and land use can often indicate inequity in environmental conditions. But also from the perspective of streets, particular sources relevant to air, noise pollution, and say the infrastructure for the safety of pedestrians are often visible at this level. And so with the emergence of the availability of data sources, as well as new techniques for processing them, there's an emerging field of study that aims to take these intuitions and make them quantitative and precise for the estimation of environmental hazards across space and time within cities. In particular, two sources of data have become much more readily available in the last decade and a half: satellite images, which are available at different spatial scales with different layers of information, such as spectral information, as well as street view images, such as those available from commercial providers, such as Google, but also is captured through primary data collection campaigns, as Sierra mentioned in the previous talk, as we did in Accra. I'll briefly touch on other forms of unstructured data, such as audio, which are also being both collected and used in environmental urban research studies, and are also amenable to being processed through the same methods that we use for images. And in particular, these methods in the last decade and a half, alongside the data, have become increasingly available through techniques developed in machine learning, and in particular those of computer vision and convolutional neural networks, which are essentially algorithmic structures capable of taking unstructured and complex forms of data and deriving specific outputs. So in the case of images, that might be the identification of particular visual features relevant for urban environmental health, like vegetation, traffic, and infrastructure, but also being able to use entire images as unstructured inputs to models in order to estimate given quantities, such as air, noise pollution, or even measures of safety. We illustrate this from using an example from our work with the time-lapsed images that Sierra mentioned we captured in Accra at 136 locations. And in this particular location, we can see how at different moments in time, the changes in specific features, so in this case, the presence of cars, indicates potential changes to, say, the level of noise a given neighborhood may be experiencing, or its perceived level of safety from a walkability perspective. However, as we know from the previous talks and our experiences in cities, the actual features and contributors to environmental change are very multidimensional, particularly as seen within images. So on Pathways, we consulted 25 of our members from different countries and continents, including Accra, to look at a sample of images and identify different features within them relevant to environmental health, which we collectively totaled as 238. From these, we shortlisted 20 based on their frequency, how useful they'd be from a research perspective, and how unique they were with respect to one another, which broadly coalesced into people, different kinds of vehicles, indicators of marketplace activity, refuse, and animals. We then labeled every one of these countable and identifiable objects, as we refer to them in computer vision, in a sample of images, and then used these to train a convolutional neural network, which is an algorithm capable of identifying countable individual instances of these objects and images, as illustrated on the slide. And we then applied this network to our 2.1 million images in order to derive their counts across space and time. From this data, we were able to infer certain patterns, such as the prevalence of different environmental features at our observation sites in Accra, such as people and different kinds of vehicles. And that also gives us a window into how these different environmental features are correlated or negatively found across the city with one another. As well as this, because of the temporal nature of our images, so they are time-lapsed at 5-minute intervals, we're able to infer environmental change over the course of a day in different features across land uses, such as how the presence of people changes as a function of the time of day at different sites. Although features themselves are an important factor in environmental health within cities and tell us something about the exposures people may be experiencing, there are other more complex visible features that inform us about environmental health. So, for example, at another one of our sites, the changes in visibility associated with images were associated with changes in PM2.5 concentrations. And so I'll hand over to Vish, who'll explain how we used both our features and the more complex unstructured inputs to models for predicting both forms of exposure.
Thanks, Ricky. So when it comes to modeling pollution using street view images, so broadly there are two approaches. The first approach is feature-driven. That means, so what we do is we extract the features manually, the relevant features that Ricky explained, and we take the counts and then we feed that into machine learning models to make the pollution prediction. So the intuition here is that the more persons or more car means more pollution. So that means the counts of the object are very relevant and we make the prediction. So that is the first approach. So in this case, it's very easy to interpret the features because we select them, but they are limited by the choice of features. So this is the first approach. So the second approach is outcome driven. So in this case, we don't make any assumptions on features. We just take the entire features, entire image as it is, and then we feed into the machine learning models. In this case, we use convolution neural network, and then we make the pollution prediction. So we are predicting noise and also air PM2.5 prediction. So in this case, the model have the liberty to choose the features of interest. And these two are complementary models, and we employ both of them. So yeah, talking about the results. So here is an example of results. We are trying to predict the pollution across time. That means we train the model on a particular site or location, and then we try to make the prediction at the same location but at a different time. So you can see the numbers that the outcome driven model is generally more accurate than the feature driven model. And when it comes to the locations, locations with predictable noise have less predictable air pollution. So this is the results for making predictions across time. And now we will see the results. This is the results for making predictions across space. That means we train the model on a set of locations, and then we evaluate on a different set of locations. So in our case, we have trained the model on 122 locations and evaluated on 13 different other unseen locations. And you can see the numbers. So the accuracies are low. So that means that the predictions are much harder to do on an unseen locations. Although the accuracies are low, despite the accuracies are low, the models, the machine learning models, they do better than the baseline models. And yeah, and then so what we do is we train the model, we make the prediction, we evaluate them, and also we make an attempt to work backwards and see what part of the image are more contributing for the pollution prediction. So if you look at the noise prediction model, it focuses mainly on the features like vehicles, and these are the features that were manually identified by us. So it makes a lot of sense. And on the air pollution model, they try to focus on the visibility changes like the red skies or haziness in the sky. And these results makes a lot of sense. So Yeah, and then we would like to conclude with this slide. So images are a rich source of information, and with the recent advancement in computer vision technologies, analyzing the features of urban mental health is a lot easier. And having said all these, still there are a lot of challenges working with complex and unstructured data. So when it comes to representativeness of the data, generalization across space and time, and the model transparency and interoperability. So with this, we would like to conclude our talk. Abeer.
Great. Do we have any questions for Sierra, Vish, and Ricky?
Thank you very much. Really, really fantastic to see all this. I had a question about in the end, it sounds like it's quite complex to do all this, especially the image-based analysis. Would you say there's any hope that this could be in fact usable, and for what purposes? I mean, are there some things that are like low-hanging fruits are definitely going to work out? I don't know, counting bicycles or something, or are there some that you think are within reach and others are just waste of time?
Yeah, thank you. So in terms of, what do we do with all of this? From the street view perspective, there are certain studies that are trying to use the kind of imagery capture infrastructure that cities already have to provide estimates where they're not available. So we very much see the images as complementary to existing sensor networks. They're more than the sum of their parts together. So to illustrate what that means in practice, you may have traffic cameras, and I think in London, they are trialing this with the TfL traffic cameras to use those for providing real-time pollution estimates. And you can imagine that gives you better spatial coverage in places where we may not have sensors, but also helps for like nowcasting in time. But I guess as these methods develop and as we have better data available for training models and more images captured, it allows us to do something akin to land use regression, but with images, and the extent to which that source of data will or won't play a role in the modeling depends on how far we can develop them.
Cool. Are there any other questions? All right. So with that, we'll be moving on to our third theme. Oh, and again, round of applause. Thanks. So our last theme of research aims to address people's experiences and perceptions of the city, as socioeconomic and environmental data are often disjointed in evaluations. These speakers will demonstrate how to harness traditional administrative, open, and citizen contributed data to capture inequalities in urban health. Yeah.
Okay, thank you. This is work with colleagues from other colleagues from the Pathways team who can't be here, and I'm going to talk about the interlinked dynamics of house prices and health in London. So just a very, very simple schematic, basically giving some background as to why we might be interested in kind of linking or bringing together these two data sets. So we're basically interested in the health of the population on the right-hand side. So, and in this particular study, we're going to look at life expectancy as a measure of health. And within London, within small areas. So that's specifically our health measure. And normally, if we look at the difference in a health metric between 1 year and 20 years later, say, and we see a difference, then we might think that the reason for that difference is a change in the environment. So for instance, the services have changed, the pollution's gone up, green spaces have been introduced or taken away, that kind of thing. But the other major driver of the health of the population is who is actually living there, who's the resident population. So for instance, you could have a different ethnicity, you could have different socioeconomic status, and those are going to change over time. And in London, certainly in the last 20 to 30 years, the major driver, or one of the major drivers of migration, or people moving from either into the city or out of the city or within the city, has been changes in house prices. So that's why we're kind of interested in bringing these two data sets together. So, of course, we don't actually have, at a very small area, these estimates of data. So we have to use modeling techniques. So first of all, life expectancy. We have death rates and population from vital statistics from the government data sets. We have we created a Bayesian hierarchical model, which models these death rates by age and year and geography. And then we use life table methods to create life expectancies. So this is the kind of output that we get. On the left-hand side, we have life expectancy in 2019. This is for males, but there are fairly similar maps for females as well. And you can see there's a huge variation. If you look at the histogram, you've got a roughly kind of 20-year life expectancy range, between the lower and higher values. And this is a hugely significant range when you think of the progress of decrease in mortality rates, and obviously therefore translated into increase in life expectancy. This is, equivalent to, say, 30 years of the decrease in mortality. So that's just across one city. And on the right-hand side, you've got the change. This is from 2002 to 2019. So again, there's massive variability just within the city of London. And I should say that the areas we have here are again the same ones that Emily referred to. So their population is about 1,500 people. So now moving on to the property prices. So it wasn't so easy to get data for this. The government registry, land registry, records all the sales at price, the place, and the date, but they don't have an awful lot of information on the characteristics of the property. So for that, we linked with a data set which we created by downloading data from a website called Rightmove, which in the UK is a real estate website. And we ended up with a data set with 1.2 million sales. And we, again, after quite a bit of modeling exploration, we created a mixed level model where we can kind of adjust for the property characteristics, and we can predict for year and space the prices. So again, we have maps on the left-hand side, 2019, and on the right-hand side, the change between 2002 and 2019. So you can see, in the red areas, very centrally, but also some further north as well. These are really very, very expensive properties. And there's a lot of variability. In fact, if you zoomed in, you would see that actually the variability can also be over very short distances. It could be like 200, 300, 400 meters down the road, you're getting a large change in the property prices. And then on the right-hand side, what was perhaps more interesting was the change between 2002 and 2019. So yes, the areas in the center have increased a lot, and the areas in the periphery of the city have perhaps in general not increased so much. But there's a lot of areas with very significant price increases, which were previously relatively cheap. I'm thinking particularly in the kind of the northeast of the center, and then also south of the river as well. So it'd be very interesting, we thought, to bring the health changes and house price changes together and try and summarize those. So the way we did this was a very simple, just a simple regression, trying to explain life expectancy change with respect to property price change. And we stratified by deciles of price in 2002. And the reason for that was that we thought that the effect of house price change may be different depending whether you started off in an expensive area or you were in a cheap area in 2002. And so we're plotting here on the x-axis the deciles, so the highest towards the right. And in those areas which were more expensive in 2002, you can see that the life expectancy gain was much higher. Whereas in the lowest area, the life expectancy change was you were not experiencing so much, once you take into account the price change. So now, looking at the relationship with price, so here we now see that the areas which were cheaper in 2002, so the lower deciles, those are experiencing a greater life expectancy increase where the prices have increased most. So this very much seems to be a kind of like a indicating that something is correlated there. I'm not going to say it's most definitely not the C word. Anyway. Okay, so that's the kind of the right-hand side of our schematic. Can we now see any evidence on the left-hand side of our schematic that house prices and demographic variables are at all related? And here we have a heat map of the correlations between change in house price and change in the demographic variables. We have demographic variables on the left-hand side, and these are so common socioeconomic status variables such as education, poverty, unemployment, but also we have variables which capture the age structure of the population. And we see, as we'd expect, that areas which have increased their house prices significantly, there have been falls in deprivation and poverty, for instance, but also areas which have increased their house price have also seen decreases in the proportion of the population who are children and younger people, so 15 to 29, and also older people. So this very much points towards the resident population changing. Okay, so just to summarize that then, first of all, the inequality in life expectancy and in the change in life expectancy is very large within London, and also is over a relatively short distance. And regardless of further price increases, where house prices were expensive in 2002, so they started off expensive, then life expectancy increased there. On the other hand, in areas which were cheaper in 2002, where house prices increased, then life expectancy increased more. And we hypothesized that the likely mechanism for this increase was a change in the resident population. That's what the changes in demographic data point towards. Okay, thank you.
Hi, everyone. My name's Emily Gemmell. I'm really delighted to be here and present some of our work. We're going to give a sort of high-level summary of some of the work that's been going on in London, Vancouver, and Accra, Ghana. that works with different types of data to build this information landscape that we need to address really wicked problems in urban settings, or really complex and multifaceted problems in urban environments. So in order to address these complex urban issues, one type of data is not really sufficient. And we have used different data sources and different data types at varying scales to kind of create an information landscape that really gives the basis for informed decisions about action and informed policy decisions. So as an example, interviews, observation, arts-based methods, and surveys are the really data types that really give you a rich, nuanced, human-level experience and hearing the voices, those solo voices from people who live in the neighborhoods and who have day-to-day interactions with these either built environment or exposures or social environment exposures. And then on the other hand, zooming out, the street view imagery, geospatial data, satellite data, social media data can give you an idea across the city of people's exposures, experiences, and perceptions. And then combining these in London, Accra, and Vancouver, we've applied these to try to really inform actionable change on these sustainable development goals. And I've listed a few here. Of course, they're intersecting, and there are many more than I've listed, but these are the main ones that we've been addressing. So in London, we've used, Emily will talk a bit more about how we've used perception of street view images to look at neighborhood walkability and who feels safe where. And, you know, as we know, it varies by individual, by their aspects of their identity and experience. So, and then in Accra, we've used some of the individual level kind of data collection measures, such as interviews, observations, to assess children's equitable access to outdoor play within the city. And increasingly, outdoor play is kind of being looked at as a determinant of health, and especially for young children, impacts development. In Vancouver, again, we've assessed children's equitable access to outdoor play, but we've also done the zoomed out version, looking at developing a metric for playability across neighborhoods, and then also incorporating assessment of perception of neighborhoods, which really influences parent and child motivation and willingness to allow their children to play outdoors. And then in Accra, social media data we've used to assess equitable access to safe drinking water. And I'm really disappointed that our colleagues from Accra were not able to get the visas to make it, but we will do our best to present their work, which is fantastic as well.
Oh, go ahead. Sorry. Hello again. So this method of analyzing perceptions using images side by side has a long history dating back to urban landscape planning in the 18th century. But aside from validating visual attributes associated with good design, perceptions can actually provide a meaningful interpretation for social activities. So, for example, physical activity or safety and crime, for example. So individual perspectives can tell us about how different groups engage with their urban environment. So in a survey in London, where users were asked to rate on which street would they prefer to walk, 86% of the users chose the image on the right. However, when we stratified by different groups, those users which were considered to have high walking activity, that is 2 or more walks per week, actually had a significant left-leaning bias after accounting for this intercept. And you can imagine what are some of the features within those images that can determine how different groups would choose differently, and especially, as Emily was mentioning, also to do with play. Once we start scaling this up, we harness all of these individually held images of the city to create a global consensus model. And we've built a pipeline to achieve this, which can then be used for cities globally and street view images globally.
So I'm really honored to present the work of my colleague, Dina Adjei Boadi. She is from the University of Ghana, and she has done a mixed methods study in 3 different socioeconomic neighborhoods in Accra. And the study has really gone in depth with children, so primary school age children, and she's done walk-along interviews with them, talked to their parents, as well as done photo voice data collection to kind of look at, when we did a literature review, we realized that very little was known about how children in Africa in particular interact with their urban environments to play. And play is, ubiquitous across cultures and settings, but the settings are very different. And so Dina has gone really in depth on this to inform and understanding in this unique context and culture. So she also did observation mapping of the play spaces, both formal and informal. So formal play spaces in Accra tend to be very sparse, and they are often limited to those who can afford to pay. So I don't know if you probably can't see this from there, but some of the playgrounds that are up here on the right side map are charged from $2 to $4 for entry. So that's just going to be a very special occasion for children who are from lower income households. And they're also far away from the low income. So when she did the spatial mapping, most of these play spaces fall within higher socioeconomic neighborhoods. In the middle, you can see pictures of children playing in different informal settings. So street play is very common. And of course, football is a favorite. And then shade was very important, which it is across contexts. Even in Vancouver, we see shade is of high priority to parents and children. And then you can see some of the conditions that children play in actually have harmful exposures. So playing in gutters, kids always love ditches, and some of the open gutters can be play areas too, which puts them at risk for gastrointestinal diseases. So Dina, through all of this gathering data and really getting that rich and nuanced data, is developing a play space index that takes into account the presence of formal space, the population of children, and the socioeconomic status to kind of map out what areas have a high population of children, very few play spaces, and the children who might be most in need of support for development and healthy movement behavior. Okay, so in Vancouver, we have done something similar. So Vancouver has a lot of evidence on the interaction of children with their urban built environments. And one of the things that's come out is parent perception of neighborhood safety is the main barrier to children getting outside. And of course, that includes traffic and social safety. And so we really wanted to, building on what Ricky was talking about perceptions of the urban environment, we've found that perceptions really influence behavior. So if our outcome is a behavior, we need not just to measure some, objective geospatial attribute, but also what do people think about that? And especially something as close to people's hearts as where they will allow their child to play outdoors. And so using Emily's basic code and protocol, we developed a web app to assess visual perceptions of neighborhoods. So we ask parents and children in this online survey, which will launch soon, where would you rather play, or what neighborhood looks best for outdoor play? And we use those ratings to train an image-based deep learning model, and then apply that model to street view images across Canadian cities. So this study will do 5 of the largest, or like a selection of 5 Canadian cities. Previously, we developed a geospatial metric to based on a theoretical model of what a playable neighborhood looks like. And so we will use these images to kind of see if they match. So based on theory, what does a playable neighborhood in Canada look like? And then does that match with parent and child perceptions?
So far we've been looking a lot at perceptions and how that influences people's choices. And what scientists often forget is that that often leads to very tangible, very quantitative data that we can harness. So we can choose to do this in different ways, but when using citizen science, I personally like to work with apps because it's something that's very accessible to most people nowadays, the young, the old, the rich, the poor, across developing countries and the developed nations as well. So in this particular example that I'm showcasing today, I've been using apps to collect data on drinking water in Accra. And the idea behind this is to highlight different equity gaps in the patterns of water consumption, because people often think that, depending on geography, someone might choose Evian over Wall Lake or tap water over bottled water. But what we've been seeing throughout the presentations today is that actually the resolution across Accra is so small. The variation in between poverty line and the rich is so fine that patterns can change very, very quickly. Citizen science and apps allows you to follow individual people throughout space and time, which means that you're not locked down necessarily in a geographical situation. And the app that I developed for Accra specifically looks at water consumption, both in the public water sector and the private water market. And the reason behind this is that people's perceptions of water can push them into consuming more public water, so maybe tap water, or inversely, if sometimes they feel that perhaps the government is not doing as good a job as they should be at providing water, then it can actually push people towards the private sector instead. And so you could imagine that actually the wealthy would turn to bottled water, but actually, in areas of poverty across the world, what I've personally seen is that it kind of tends to be the opposite. It's the poorer people who tend to diversify their water sources more because they're scared of not being provided for. So through this app, we're able to collect lots of different information, ranging from consumer-specific information, and this can be, quite personal information such as age or gender, or perhaps where someone lives or works. But I can also extend it to look at the water market specifically. So what brands are people buying? How much are they buying them at? Are they buying them at $1 in the south of the city and at $3 in the north of the city? What are the patterns in the water market as well? And the nice thing about using citizen science and apps is that you can refine the data that you get as much as you want. So if you want more data on brands, you can list more brands, or you can ask for more information about that. But equally, if you just want a snapshot in urgent situations, for example, where you want to intervene quickly, you can also do that in a very effective way. So what I've seen in previous work is that actually you can apply this method to get a lot of information across a short time frame on a wide geographical area and for a very low cost. The bulk of the cost is really to create the app and to disseminate it. Then it's kind of runs its own show. So this is particularly useful in areas which might not have a lot of funding. They wouldn't be able necessarily to carry out surveys or to deploy sensors. They probably wouldn't either have the capacity to develop models or predictions. So this is really more of a grassroots approach to generate data where there isn't anything to work with. And then, you can map that out in different ways. You can overlap it with socioeconomic data if that's what you're trying to highlight inequity in, or equally, you can use that as a base to supplement data that's already pre-existing. So we were talking earlier about imagery data, about already collected government data, statistical bureau data, and things like that. And the idea is obviously that by the end of it, you would have very specific data to inform policymaking. And so you would be not only able to cater to different geographic locations, but to different demographics as well. And if there was something lacking in your data, you would be able to reiterate it as many times as you needed to be able to fill that gap and come to a solid policy resolution.
So when we, in our own context, think about building information landscapes for sort of actionable policy and actionable change on other levels, the importance that's emerged to us from working across all of these different contexts of interdisciplinarity, integrating diverse knowledge types at different scales, and doing this iteratively has been one of the insights that's emerged from this collaboration. So we see the importance of solo voices to just define the question. Hearing from people who have lived experience in the neighborhood and getting that rich, nuanced sense of the diversity of experience between groups and between individuals. And then also listening and being able to hear voices at the group level. And looking especially at groups that might be marginalized. And then using these interdisciplinary collaborations to mix all of these data sources in order to identify inequity, elevate those voices that might be marginalized, motivate political will, and inform action and policy. I think that that's been my major takeaway from working across these different settings and with these different knowledge types, that we can't do without those really local voices. And then also the opportunity to scale up gives us a view of the whole city. And then we'd like to share a bit if you'd like to look at our apps and also the methodological toolkit that was used both in London and Vancouver to develop the online surveys for measuring perception, and then the equitable access to drinking water in Accra. Yeah, the playability one is still in development. So thank you.
All right. Does anyone have any immediate questions for this last group? I think that we're going to be moving into our larger group discussion where I'll bring everyone back on stage. And they can, if you want to talk, ask them anything, you can. And then of course, we'll all be here. But I just wanted to go ahead and say that the data downloads, I know that there were QR codes that may not be scannable, but everything is available on our website of equitablehealthycities.org/data download, or of course, you can probably find it easily on the website. Some things may not be available if it's due to protection images, such as some of the satellite work, but that's fine. And if you have any questions or would like to know more about the Pathways to Equitable City program, please feel free to contact me. And my email is up there. So yes, can all of you come back up? And if anyone has any questions, go ahead. If we don't have any questions, actually, I guess we could end our session and we can all go enjoy the other amazing talks that are happening. Perfect. Awesome. Cool. All right. Thanks everyone for listening.